What were the circumstances when you said, I cannot care for my son?
After the domestic violence, I ran away to Melbourne because the violence happened in Perth. Thought if I moved state that he would be okay. So when he was 7, he tried ending his life.
Women don't have to keep repeating their story and re-traumatizing themselves.
For everyone we know about, there's probably 3 or 4 we don't know about.
Thank you again coming back to the room with an open mind. And we have talked difficult topics. I want to keep this one a bit more solution focused. We have talked about things, but we want to still have a context of where we are coming from. And in my opening speech, I talked about the one system, the way the system is failing, not just across states, but within the state as well. But I think that can be very clearly explained. I think, Daniel, I would really want you to explain that story of moving between Victoria and Western Australia, and that journey of when you're working with 2 different child protection systems. And then also I want you to talk about, what were the circumstances when you said, I cannot care for my son, and taking that bold decision or difficult decision to come to a conclusion that, it's not happening.
Okay, so after the domestic violence, I ran away to Melbourne because the violence happened in Perth. And this is going like 15 years ago when you could do things like that. And I went into hiding, and it was trying to start a whole new life again, really. People didn't know my story, and I liked it that way. But unfortunately, my son was very much traumatized already. I thought if I moved state that he would be okay. I thought if I take away the triggers, if I take away the parks that he knew, if I took away the people that he knew in the suburbs, that he would just be okay. But it did not happen because the trauma was so embedded already in him. So when he was 7, he tried ending his life. And my other son saw it and ran in to get me. And I was actually on the phone to a social worker, basically because I saw the warning signs. And I remember going to a children's hospital in Melbourne and saying, something is wrong with my son, you need to help me. And they turned around and said, you take your son home or we take him to child protection. And that's the unfortunate side that a lot of us have seen, that if there's no actual right now crisis moment, you're kind of put in line to just wait until there is one. So when he tried to end his life, the police came, and they were they didn't know what to do. They had no idea what to do at all. And so they were about to leave. They obviously took the knife off him and told him, we don't do things like that. And then the ambulance came, and the ambulance was like, no, we need to take this child to a hospital immediately. Something's really wrong with this child. And so forever I will be grateful for those ambulance drivers that were actually trained in understanding family domestic violence. And I think that just says so much just there, how we need to make sure our frontliners are so well educated in different situations, not just one. And so he went into a kids' mental hospital where he was observed for 2 weeks with and without me. And the professionals were flown in, and there was a lot of, tests and everything were done. And I was sat down by child protection, by the hospital of the mental institution, and by a few other people, and told that my son had chronic PTSD and that my face was a trigger to his trauma. And as a mum, I think we can all understand how much that would hurt. So I went on a reunification order with my son. He was immediately taken for the safety of my other child because he had previously strangled him and was passed out on the floor. When he would commit the violence, he wasn't present. So that's what I kept on explaining to the professionals. Like it was like he had a deer with a headlight look. Yeah. And they explained to me that that's him going into a flashback. So he actually didn't know that he was hurting his brother or whoever it was. And so we went on a reunification order. Over in Melbourne, I don't know if it's changed since then, but over in Melbourne, if you are on a reunification order for more than 3 years and there is no progress happening where that child is returning home, you lose full custody of your child. So I freaked out and I begged the magistrate to let me go back to Perth where I had support. And we were lucky enough they did so. And then I realized that I had made the worst decision of my life because I now had a traumatized child that was back at stage 1, trying to end their life and just an absolute mess from all the trauma that they had endured. And so I made a very, very difficult decision as a mother. And I went to Child Protection Perth and I said, we have been under Child Protection Melbourne and I need to give my child back. I'm very worried for his safety and my safety. And I released permanent care of my child to Child Protection. It's not easy, as in like the system itself in Child Protection. So what I've realized over in time is even though they're Child Protection WA, Child Protection Victoria, they do not connect. I'm seeing shaking heads. You understand, yeah. They do not actually connect, and it was very difficult to get the documents, to get the help that I needed, even though I was still in the same country.
And I think this is a classic case of, not an exception, probably the norm. And then that's why the idea of the conversation on one system should be had not just statewide, but across jurisdictions. Sophie, can I get you to a bit more elaborate on the idea of relational care and how do we, and people around or safe adults around kids? Because I think there are many people who are touch points in a child's life across growing up. And that one system will fail if the whole life cycle of a young child to adulthood is not cared for or understood deeply and meaningfully. So you talk about the relational care and safe adults. Can you just elaborate on that idea?
Thanks, Dev, and thanks for having me, and thanks for your story. Danielle, I always want to just acknowledge that when I talk about systems, it's so great for me to be reminded of the people in the system. So when I talk about this in a very general sense, please know that I know the humans in it. So exactly as has been so brilliantly explained, child protection systems are very much geared towards crisis and responding to crisis. And what we're advocating for and thinking about at the Centre for Relational Care is what if the system was absolutely oriented towards relationship and moving away from that sort of child protection orientation, which is very much geared around compliance, risk mitigation, paperwork, towards child connection system, which is making sure that the relationships around a child, their parents, if their parents are the ones that really need that support system, their communities and their families. So just that orientation is something that we're really saying is a way that the system can think about itself as a relational response to the very difficult circumstances that lots of people have talked about today. And we're really guided by the voices of young people and what young people continually tell us who've experienced out of home care is what they most want is belonging. They want connection. They want to feel known. They want to feel safe, of course, but they feel like that should just be a given. What workers in the system often tell us is what gets in the way of their relational practice is paperwork, is trying to work out whether the risk to their entity is worth them doing that relational work, trying to put in another compliance. We can really make sure that we can embed relational care approaches. And as we all know, relationality is what gives us life and what makes us flourish. So that question about how does it impact on a child's longer term life? We know that. Our First Nations friends have been telling that for many thousands of years as well. So we all know about relationality and the importance of relational practice. Yet we've learned through continual sort of bureaucratic systems that we've got to put some kind of, compliance over our human nature. So I could keep going on, but I know that there's other people.
Thank you, Sophie. Malini, I'll go to you. And again, the pretext of one system, collaboration data, if you're trying to bring people systems together and then merge into one, or it should talk to each other, there has to be clear accountability at every stage and every step. And then all the work you're doing with your organization, and you are talking to specifically multicultural and CALD communities, what kind of accountability gap you are observing, and how do you see that the idea of one system would support the argument that multicultural community and CALD communities are also not dealt the right cards in terms of the child and family safety.
Yeah. So, big question. I guess in multicultural communities, women don't go to formal services first. So they go to community leaders, they go to faith leaders, they go to settlement workers, they go to trusted people, family networks. So this I call the infrastructure behind the infrastructure. So these are the front door for multicultural communities. And so they are not resourced, they're under-resourced, but the accountability is shifts to them as a response when they're under-resourced. And also the system is just not safe for multicultural women to engage in. So I think that this infrastructure behind the infrastructure, or these community organisations which are doing all the load bearing and propping up the system for multicultural communities, need to be recognised as part of the formal ecosystem of family and supporting women and families and children. And also in terms of, one system, multicultural women don't experience harm in neat policy silos. They experience visa insecurity. They interact with Centrelink, child support, legal, housing, and all of those, don't talk to each other. And so it's about having those systems interact so that women don't have to keep repeating their story and re-traumatizing themselves, and also navigating different sets of rules which don't make sense. So I think in the medical system, they have multidisciplinary teams where, different specialists come together around a particular case. And so that particular patient doesn't have to navigate the system themselves. So I think a similar thing for women and children and people coming together around them across the systems, across jurisdictions. So it's not about one department passing it on to the other department, but working together to, create one system. But one system doesn't mean one size fits all. It means a culturally responsive system centered around the woman and the child.
Thank you, Malini. And Andrea, I want to ask a question from Slido. Because you've worked across multiple systems or touch points, Carl, the question is, what shared standards data principles, accountability mechanisms are needed to make a connected safeguarding system work in practice?
I could give you an example.
Please do.
So when I went to work for the church after 30 years of policing, I already said it was a bit of a different environment. There were some similarities, but it was very different as well. And one of the tasks was to manage the child sex offenders that were coming to church. So, and I'm not talking about people that have been charged and are awaiting. I'm talking about convicted child sex offenders, those who have gone to prison for their offences and have done their time and have come out. And many of the child sex offenders that are in prison will come out of prison, whether they went in with a faith base. That many of them come out with a faith base because of the great work that the faith-based organisations do in prison. So for many of them, the first stop is a church. And for many of them, there seem to be enough in the Catholic Church, but that's just the Catholic Church. I mean, my counterpart in the Anglican Church, the lady that was doing my job in the Anglican Church, she had probably more that she knew of than I knew of. And so the system is set up. And remember, this was the beginning of safeguarding. It's not where we are now, 10 years down the track. It was the very beginning, and there were no systems. We had to create them. So essentially what was happening, people would come out of prison, they would come to church, someone would see them, someone would make a complaint to us, tell us, well, why are they at church, or let us know that that's where they've been, and relay their concerns. So then we have to manage this person. We have to manage this individual. And where we do that in a parish, the congregation aren't told. I mean, the priest doesn't rock up to Sunday Mass and say, oh, in this week's bulletin, I'm just going to let you know we've got John here. He's just come out of prison. Priest can't say that. So nobody knows. Safeguarding officers know, the priest knows, and that's probably about the only people that can know. And as you can imagine, other parishioners get all upset about this, especially at that time when all the news was on the Catholic Church. So they'd get upset about it. And then they'd come to my office and then they'd make complaints to me. And again, I come back to the conversation. You have to have the conversation. And one of the conversation pieces I used to share with the people who complained, I used to say, well, at least we know about them. If I'm managing them, we know about them. And for everyone we're managing, there's probably 3 or 4 we don't know about that's coming to church as well. And then they get it. Because again, it's the conversation, it's the knowledge that you share. But my point here, as I think what you're asking me, Dev, is that these people are convicted sex offenders. So they come out and they're on the sex offender register. Okay, they're overseen by ANCOR. And the officers that are attached to ANCOR know where they put a whole lot of parameters on these people. And one of them is not go to church. They're allowed to go to church. And they should be allowed to go to church. But we have to place that safety around the child as the priority. And we do that. There's all different regimes that are put in place to ensure that. But it would be really easy for them to tell us when someone is going to come to our church. It can be a question. When you're coming out and you're doing your questionnaire with your ANCOR register, and some of the questions police can ask them is, is it your intention to start going to church? And if so, which church do you think you're going to go to? And it would be as simple as just letting us know that.
Mm-hmm.
Because we're supposed to manage these sex offenders. We're supposed to keep the children safe. We're supposed to comply with all the compliance, but you tell us nothing. So I was asked to give evidence to the Royal Commission in 2015. And a very similar question was asked of me then, Dev, and I thought, oh, this is my opportunity. And I said to the Royal Commission, I said to the Commissioner, I said, you need to throw us a bone. And essentially that's what it is. You need to throw us a bone. If you want us to do this work for you, you need to throw us a bone and you need to help us with it. That went nowhere. I met with the officer in charge of the Sex Crimes Division, and she's a friend of mine, and she goes, Andrea, you know what you're asking me. You know it's not going to happen. I said, well, I know it's not going to happen. It can't happen now, but it can happen in the future. And I think that's where we need to, where we can work more collaboratively is that, that's a system. It's a very easy system to put in place. I mean, there would have to be confidentiality around it, but it could work. And I think that's a way a system could keep children even safer. Because for everyone we know about, there's probably 3 or 4 we don't know about. Okay. I don't know if that answered the question, but
Thank you. Thank you. I think that's fairly not conclusive. I think that covers a fair amount of breadth of the topic. Sophie, can I come to you? But the question talks about the biggest points of fragmentation between child protection, health, education, justice, housing, family violence systems. But all those fragmentations are opportunities. So how can we? So if you can talk about the fragmentation and also talk about what is opportunities to bring it together.
Yeah, it's interesting, isn't it? Somebody said to me recently, if all of the other service areas of education, health, housing, uh, justice were doing their jobs really well, then we wouldn't need a child protection system. So I think there's something around this is everybody's issue, looking after kids and enabling them to flourish. Uh, but there is such competition in the way that our modern government has been organised. And when I talk about relational systems, I'm talking about it at all layers, and that comes from the community and the families around children and parents, right up to the big organising systems of government. And there's something about the relationships between governments that could be if everyone just metaphorically put all their money on the table and said, how do we actually use all this money to the best advantage for children's outcomes? That would be such a better conversation than how do we use this money to, make my department look the best or make our minister say the best thing at the next cabinet meeting. And that's hard. You've got to give up something. You've got to give up power. You've got to give up ego. You've got to give up self-interest. And I think, there's a movement of people. We're all on this stage. We're all in this room, who we're doing the radical incremental work of saying, actually, we don't want that kind of system anymore. And I know when we talk about systems change, it feels, very difficult and sometimes very esoteric. But I think the more we keep doing the different work and say we stand for an alternative, the more that governments will listen. So I think there's a way to not wait for governments to do something different and for us to be the glue that makes them do something different.
Thank you. Thanks for sharing that. Again, Malin, you are working on a whole piece of work, which is you are interacting with different communities, and and there are some thematic pieces of work you've been working on, and there is a shared accountability and across multiple disciplines. We were discussing when we were prepping for this. Can you elaborate on the insights coming out of it, and what kind of shared accountability you are seeking or thinking of?
Yes. So we are the Australian Multicultural Women's Alliance. We're one of 5 national women's alliances funded by the Office for Women to provide intersectional insights to the government across 5 key focus areas. So gender-based violence, health, paid and unpaid care, leadership, and economic security. And they all interact. And so I think, so we've conducted thematic working groups across those areas over the last week or so, actually. And one of the things that is consistent across all of the thematic working groups is that the system is just not designed for multicultural women. And the system is not designed, women are not lacking capability, they're not lacking ambition, they're not lacking skills, they're not lacking, want for what everyone else wants, safety, belonging, etc. They are just stuck in a system that isn't designed for them. And they can't navigate it because they don't trust it and it's not safe. So I think the key things that are coming out of the thematic working groups is culturally responsive services and approaches across all, I guess, departments, policy, etc. Access to language and language access in terms of interpreters or support to make sure that they understand the jargon they're just not familiar with some of the terms, etc., and making sure that they get the best services possible. And then centering lived experience and community insight in everything, which means ensuring that everything is co-designed with community, not assuming what they need. There's so many grassroots organizations doing amazing, wonderful work. They are closest to the problems, so they know the solutions. So incorporating that, which would mean that a lot of the solutions that are developed by government are often more complex than they need to be. And if you just engage with community, you will get a more efficient solution, which will cost less. And then investment in primary prevention and early intervention. Another thing is economic security is a foundation for safety. And we're doing a piece of work, which I can talk about later on, migrant skills recognition. But if people have economic security, they have financial independence, they have choice, and they are less likely to stay in vulnerable situations. And then data, so there is no disaggregated data for multicultural women. That means we're invisible in the solutions. So if we can get disaggregated data which shows how they're accessing services, and what I talked about before is they're not actually getting to the services because the community is doing all the heavy lifting. If they can have the knowledge to be able to direct them in a safe way to those mainstream services, they'll start appearing in the data, and therefore policies can be made around them. And then it's multicultural women being involved in the decision making and actually having a seat at the table, but also having a voice, and not just consultation, an extractive consultation where they're asked for their opinions and not rewarded or not resourced for that. And so I think that if we can engage multicultural women, co-design, we can get services that they trust and that are safe, and therefore that they will start interacting with them. And that's where we can keep women and children safe, because if they are co-designing the solutions, then they're more likely to interact with them.
Thank you.